Hello and welcome back to What the Health. I'm Julie Rovner, Chief Washington Correspondent for KFF Health News, and I'm joined by some of the best and smartest health reporters in Washington. We're taping this week on Friday, June 20th at 10 a.m. As always, news happens fast and things might have changed by the time you hear this. So here we go. Today we are joined via video conference by Miranda Ollstein of Politico.
Hello.
Sandhya Raman of CQ Roll Call.
Good morning.
And Victoria Knight of Axios News.
Hello, everyone.
No interview this week, but more than enough news to make up for it, so we will go right to it. It is June. That means it is time for the Supreme Court to release its biggest opinions of the term. On Wednesday, the justices upheld Tennessee's law banning gender-affirming medical care for trans minors, and presumably that means similar laws in 24 other states can stand as well. Alice, what does this mean in real-world terms?
So this is a blow to people's ability to access gender-affirming care as minors, even if their parents support them transitioning. But it's not necessarily as restrictive a ruling as it could have been. The court could have gone farther, and so supporters of access to gender-affirming care see a silver lining in that the court didn't go far enough to rule that all laws discriminating against transgender people are fine and constitutional. A few justices more or less said that in their separate opinions, but the majority opinion just stuck with upholding this law, basically saying that it doesn't discriminate based on gender or transgender status.
Which feels a little odd.
Yes. So obviously, many people have said, how can you say that laws that only apply to transgender people are not discriminatory? So been some back and forth about that, but the majority opinion said, well, we don't have to reach this far and decide right now if laws that discriminate against transgender people are constitutional because this law doesn't. They said it discriminates based on diagnosis. So anyone of any gender who has the diagnosis of gender dysphoria for medications, hormones, that's not a gender discrimination. But obviously the only people who do have those diagnoses are transgender. And so it was a logic that the dissenters, the three progressive dissenters, really ripped into.
And just to be clear, I mean, we've heard a lot, there are a lot of laws that ban sort of not reversible types of treatments for minors, but you could take hormones or puberty blockers. This Tennessee law covers basically everything for trans care, right?
That's right, but only the piece about medications was challenged up to the Supreme Court, not the procedures and surgeries, which are much more rare for minors anyways. But it is important to note that some of the conservatives on the court said they would have gone further, and they basically said, this law does discriminate against transgender kids, and that is fine with us. And they said the court should have gone further and made that additional argument, which they did not at this time.
Well, I'm sure the court will get another chance sometime in the future. While we're on the subject of gender-affirming care in the courts, in Texas on Wednesday, conservative federal district judge Matthew Kacsmaryk, that's the same judge who unsuccessfully tried to repeal the FDA's approval of the abortion pill a couple of years ago, has now ruled that the Biden administration's expansion of the HIPAA medical privacy rules to protect records on abortion and gender-affirming care from being used for fishing expeditions by conservative prosecutors was an overreach, and he slapped a nationwide injunction on those rules. What could this mean if it's ultimately upheld?
I kind of see this in some ways like the Trump administration getting rid of the EMTALA guidance, where the underlying law is still there. This is sort of an interpretation and a guidance that was put out on top of it saying, we interpret HIPAA, which has been around a long time, to apply in these contexts because we're in this like brave new world where we don't have Roe versus Wade anymore, and states are seeking records from other states to try to prosecute people for, circumventing abortion bans. And so that wasn't written into statute before because that never happened before. And so the Biden administration administration was attempting to respond to things like that by putting out this rule, which is now been blocked nationwide. I'm sure litigation will continue. There are also, efforts in the courts to challenge HIPAA more broadly, and so I would be interested in tracking how this plays into that.
Yeah, there's plenty of effort sort of on this front, and certainly with the advent of AI, I mean, I think that medical privacy is going to play a bigger role sort of as we go forward. All right, moving on. While the Supreme Court is preparing to wrap up for the term, Congress is just getting revved up. Next up for the Senate is the budget reconciliation, quote, big, beautiful bill with most of President Trump's agenda in it. This week, the Senate Finance Committee unveiled its changes to the House-passed bill, and rather than easing back on the Medicaid cuts, as many had expected in a chamber where just a few moderates can tank the entire bill, the finance version makes the cuts even larger. Do we have any idea what's going on here?
Well, I think mostly they want to give themselves more flexibility in order to pursue some of the tax policies that President Trump really wants. And so they need more savings, basically, to be able to do that and be able to do it for a longer amount of years. And so that's kind of what I've heard is they wanted to give themselves more room to play around with the policy, see what fits where. But a lot of people were surprised because the Senate is usually more moderate on things. But in this case, I think it's partially because they specifically looked at a provision called provider taxes. It's a way that states can help fund their Medicaid programs. And so it's a tax levied on providers. So I think they see that as maybe, it doesn't, it could still affect people's benefits, but it's aimed at providers. And so maybe that's part of it as well.
Well, of course, aiming at providers is not doing them very much good because hospitals are basically freaking out over this. Now there is talk of creating a rural hospital slush fund to maybe try to quell some of the complaints from hospitals and make some of those moderates feel better about voting for a bill that the Congressional Budget Office still says takes health insurance and food aid from the poor to give tax cuts to the rich. But if the Senate makes a slush fund big enough to really protect those hospitals, wouldn't that just eliminate the Medicaid savings that they need to pay for those tax cuts, Victoria? That's what you were just saying. That's why they made the Medicaid cuts bigger.
Yeah, I think there's quite a few solutions that people are throwing around and proposing. But exactly. Depending on if they do a provider relief fund, then the savings may need to go to that. I've also heard, I was talking to senators last week, and some of them were like, I'd rather just go back to the House's version. So the House's version of the bill put a freeze on states' ability to raise the provider tax. But the Senate version, incrementally lowers the amount of provider tax they can levy over years. The House just freezes it and doesn't allow new ones to go higher. Some senators are like, actually, can we just do that, go back to that? And we could live with that. Even Senator Josh Hawley, who has been one of the biggest vocal voices on concern for rural hospitals and concern for Medicaid cuts, he told me, freeze would be okay with me. And so I don't know. I could see them maybe doing that, but we'll see. There's probably more negotiations going on over the weekend, and they're also going to start the bird bath procedure, which basically determines whether provisions in the bill are related to the budget or not and can stay in the bill. And so there's actually gender-affirming care and abortion provisions in the bill that may get thrown out because of that. So
yeah, this is just for those who don't follow reconciliation the way we do. The bird bath, named for the former Senator Byrd, who put this rule in that said, look, if you're going to do this big budget bill with only 50 votes, it's got to be related to the budget. So basically, the parliamentarian makes those determinations. And what we call the bird bath is when those on both sides of a provision that's controversial go to the parliamentarian in advance and make their case. And the parliamentarian basically tells them in private what she's going to do, like this can stay in or this will have to go out. If the parliamentarian rules it has to go out, then it needs to overcome a budget point of order that needs 60 votes. So basically, that's why stuff gets thrown out unless they think it's popular enough that it could get 60 votes. And sorry, that's my little civics lesson for the day. Finish what you were saying, Victoria.
No, that was a perfect explanation. Thank you. But yeah, I was just saying, I think that there are still some negotiations going on for the Medicaid stuff. And we're also, you have to remember, this has to go back to the House. And so it passed the House with the provider tax freeze. And that was still required negotiations with some of the more moderate members of House Republicans. And some of them started expressing their concern about the Senate going further. And so they still need to, it has to go back through the House again. So they need to make these Senate moderates happy and House moderates happy. There's also the, fiscal conservatives that want deeper cuts. So there's a lot of people within the caucus that they need to strike a balance. And so I don't know if this will be the final way the bill looks yet.
Although I think I say this every week, we have all of these Republicans saying, I won't vote for this bill. I won't vote for this bill. And then they inevitably turn around and vote for this bill. Do we believe that if these people really would tank this bill?
That's a great point. Yeah. Sandhya, go ahead.
I mean, there are at least a couple that I don't think, anything that we do, they're not going to change their mind. There is no courting of Representative Massey in the House because he's not going to vote for it. I feel like in the Senate, it's going to be really hard to get Rand Paul on board just because he does not want to raise the deficit. I think the others, it's a little bit more squishy, depends kind of what the parliamentarian pulls out. And I guess also one thing I'm thinking about is if the things they pull out are big cost savers, then they have to go kind of back to the drawing board to generate more savings. I mean, we've only had a few of the things that they've advised on so far, but it's not health, and we still need to see, health are the big point. So I think...
Well, they haven't started the bird bath on the finance provisions
yes,
of the finance committee's provision, which is where all the health stuff is.
But that is supposed to be over the weekend. It's supposed to start over the weekend. Yeah.
Right.
Yeah. So I think depending on that, we will see. Historically, we have had people kind of go back and forth. And even with the House, there were people that voted for it that then now said, well, I actually don't support that anymore. So I think just going back to just what the House said might not be the solution either. They have to find some sort of in-between before their July 4th deadline.
I was just going to say, so does this thing happen before July 4th? I noticed that Susie Wiles, the White House Chief of Staff, said, it needs to be on the president's desk by July 4th, which seems pretty nigh impossible. But I could see it getting through the Senate by July 4th. I'm seeing some nods. Is that still the goal?
I think that's the goal. That's what Senate Majority Leader Thune has been telling people. He wants to try to pass it by start the process by midweek, and then it's going to have to go through a vote-a-rama. So it's going to, Democrats will be able to offer a ton of amendments. It'll probably go through the night, and that'll last a while. And so I saw some estimate maybe it'll get passed next weekend through the Senate, but that's probably if everything goes as it's supposed to go. So something could, mess that up. But yeah, I mean, I think the factor here I think everyone's kind of been like, they're not going to be able to do it. They're not going to be able to do it with the House, especially the House is so rowdy. But then when Trump calls people and tells them to vote for it, they do it. I mean, there's a few, like Rand Paul and Massey. They're like basically the only ones that will not vote when Trump tells them to. But other than that, so if he wants it done, I do think he can help push to get it done.
Yeah, I noticed one change as I was going through in the Senate bill from the House bill is that they would raise the debt ceiling to $5 trillion. It's like, that's a pretty big number. I'm thinking that alone is what says Rand Paul is a no. Before we move on, one more thing I feel like we can't repeat enough. This bill doesn't just cut Medicaid spending. It also takes aim at the Affordable Care Act and even Medicare. And a bunch of new polls this week show that even Republicans aren't super excited about this bill. Are Republican members of Congress going to notice this at some point? I mean, yeah, the president is popular, but this bill certainly isn't.
I mean, when you look at sort of the town halls that they've had or tried to have over the last couple months and then kind of scaled back because there was a lot of pushback directly on the Medicaid provisions. I mean, they have to be aware, but I think if you look at that polling, if you look at the people that identify as MAGA within Republicans, it's popular for them. It's just more broadly less popular. So I think that's part of it, but
I think that people are very opposed to the policies in the bill, but I also think people are very overwhelmed and distracted right now. There's a lot going on, and so I'm not sure there will be the same national focus on this the way there was in 2017 when people really rallied in huge ways to protect the Affordable Care Act and push Congress not to overturn it. And so I think maybe that could be a factor in that outrage not manifesting as much. I also think that's the reason they're trying to do this quickly. The July 4th deadline before those protest movements have an opportunity to sort of organize and coalesce. Just real quickly on the rural hospital slush fund, I saw some smart people comparing it to a throwback, the high risk pools model, in that unless you pour a ton of funding into it, it's not going to solve the problem. And if you pour a ton of funding into it, you don't have the savings that created the problem in the first place, the cuts. And all that is to say, also, how do we define rural? Like, a lot of suburban and urban hospitals are also really struggling currently and would be subject to close. And so now you get into the, pitting members and districts against each other because some people's hospitals might be saved and others might be left out in the cold. And so I just think it's going to be messy going forward.
I spent a good part of the late 80s and early 90s pulling out of bills little tiny provisions that would get tucked in to reclassify hospitals as rural so they could qualify, because there are already a lot of programs that give more money to rural hospitals to keep them open. Sorry, Victoria, we should move on, but you wanted to say one more thing.
Yeah. No, I was just going to say, going back to the unpopularity of the bill based on polling, and I think that we'll see at least Democrats, if Republicans get this done and, they have the work requirements and the other cuts to Medicaid in the bill, cuts to ACA, no renewal of premium tax credits, I think Democrats will really try to make the midterms about this, right? Like, we already are seeing them messaging about it really hardcore. And obviously the Democrats are trying to find their way right now, post-Biden, post-Harris. So I think they'll at least try to make this bill the thing that, and see if it's unpopular with the general public, what Republicans did with healthcare on this. So we'll see if that works for them, but I think they're going to try.
Yeah, I think you're right. Well, speaking of Medicare, we got the annual trustees report this week, and the insolvency date for Medicare's Hospital Insurance Trust Fund has moved up to 2033. That's 3 years sooner than predicted last year. Yet there's nothing in the budget reconciliation bill that would address that, not even a potentially bipartisan effort to go after upcoding in Medicare Advantage that we thought the Finance Committee might do that would save money for Medicare that insurers are basically overcharging the government for. What happened to the idea of going after Medicare Advantage overpayments?
I mean, my general vibe I got from asking senators was that Trump said, we're not touching Medicare in this bill. He did not want that to happen. And I think, again, maybe potentially thinking about the midterms, just the messaging on that, touching Medicare. It kind of always goes where they don't want to touch Medicare because it's older people, but Medicaid is okay, even though it's, poor people. So,
and older people.
And they are touching Medicare in the bill anyway.
Thank you. I know. I think that's the part that makes my head swim. It's like, really, there are several things that actually touch Medicare in this bill, but the thing that they could probably save a good chunk of money on and that both parties agree on is the thing that they're not doing.
Yeah,
all right.
Exactly. It was very bipartisan. So.
It was very bipartisan, and it's not there. All right, moving on. Elon Musk has gone back to watching his SpaceX rockets blow up on the launch pad, which feels like a fitting metaphor for what's been left behind at the Department of Health and Human Services following some of the DOGE cuts. On Monday, a federal judge in Massachusetts ruled that billions of dollars in cuts to about 800 NIH research grants due to DEI were, quote, arbitrary and capricious, and wrote, quote, I have never seen government racial discrimination like this. And mind you, this was a judge who was appointed by Ronald Reagan. So what happens now? It's been months since these grants were terminated, and even though the judge has ordered the funding restored, this obviously isn't the last word, and one would expect the administration's going to appeal, right? So these people just supposed to hang out and wait to see if their research gets to continue?
I mean, this has been a big thing that has come up in all of the appropriations hearings we've had so far this year, that even though the gist of that is to look forward at the next year's appropriations, it's been a big topic of just, there is funding that we as Congress have already appropriated for this, why isn't it getting distributed? So I think that will definitely be something that they push back up on the next ones of those. Some of the different, senators have said that they've been looking into it, how it's been affecting their districts. So I would say that, but I think, the White House in response to that called the decision political, which I thought was interesting given like you said, it was a Reagan appointee that said this. So it'll definitely be something that I think will be appealed and be a major issue.
Yeah, and the folks I've talked to who've been impacted by this stress that you can't flip funding on and off like a switch and expect, research to continue just fine. Once things are halted, they're halted. And in a lot of cases, it is irreversible. Samples are thrown out, people are laid off, labs are shut down. Even if there's a ruling that reverses the policy, that often comes too late to make a difference. And at the same time, people are not waiting around to, see how this back and forth plays out. People are getting actively recruited by universities in other countries saying, hey, we're not going to defund you suddenly, come here. And they're moving to the private sector. And so I think this is really going to have a long impact, no matter what happens, a long tail.
And yet we got another reminder this week of the major advances that federally funded research can produce, with the FDA approval of a twice-a-year shot that can basically prevent HIV infection. Will this be able to make up maybe for the huge cuts to HIV programs that this administration is making?
I mean, it's only one drug, and we have to see what the price is. What
so far the price is huge. I think I thought it was going to be like $14,000 a shot,
which means that something like PrEP is still going to be a lot more affordable for different groups, for states, for relief efforts. So I think that it's a good step in on the research front. But I mean, until the price comes down, the other tools in the toolbox are going to be a lot more feasible to do.
Yeah. So much for President Trump's goal to end HIV. So very first term. All right. Well, turning to abortion, it's been almost exactly 3 years since the Supreme Court overturned the nationwide right to abortion in the Dobbs case. In that time, we've seen abortion outlawed in nearly half the states, but abortions overall rise due to the expanded use of abortion medication. We've seen doctors leaving states with bans for fear of not being able to provide needed care for patients with pregnancy complications. And we've seen graduating medical students avoiding taking residencies in those states for the same reason. Alice, what's the next front in the battle over abortion in the U.S.?
It's been one of the main fronts even before Dobbs, but it's just all about the pills right now. That's really where all of the attention is. So whether that's efforts ongoing in the courts back before our friend Kaczmarek to try to challenge the FDA's policies around the pills and impose restrictions nationwide. There's efforts at the state level. There's agitation for Congress to do something, although I think that's the least likely option. I think it's much more likely that it's going to come from agency regulation or from the courts or from states. So I would put Congress last on the list of actors here. But, I think that's really it. And I think we're also seeing the same pattern that we see in gender-affirming care battles, where there's a lot of focus on what minors can access, what children can access, and that then expands to be a policy targeting people of any age. So I think it's going to be a factor. One thing I think is going to slow down significantly are these ballot initiatives in the states. There's only a tiny handful of states left that haven't done it yet and have the ability to do it. A lot of states, it's not even an option. So I would look at Idaho for next year and Nevada, but I don't think you're going to see the same storm of them that you have seen the last few years. And part of that is because, like I said, there's just fewer left that have the ability. But also, some people have sort of soured on that as a tactic and feel that they haven't gotten the bang for the buck because those campaigns are extremely expensive, extremely resource intensive. And there's been frustration that in Missouri, for instance, it's sort of been the will of the people has sort of been overturned by the state government, and that's being attempted in other states as well. And so it has seemed to people like a very expensive and not reliable protection, although I'm not sure in some states what the other option would even be.
Of course, the one thing that is happening on Capitol Hill is that the House Judiciary Committee last week voted to repeal the 1994 Freedom of Access to Clinic Entrances Act, or FACE. Now, this law doesn't just protect abortion clinics, but also anti-abortion crisis pregnancy centers. This feels like maybe not the best timing for this sort of thing, especially in light of the shootings of lawmakers in Minnesota last weekend, where the shooter reportedly had in his car a list of abortion providers and abortion rights supporters. Might that slow down this FACE repeal effort?
I think it already was going to be an uphill battle, in the Senate and even maybe passing the full House because, even some conservatives say, well, I don't know if we should get rid of the FACE Act because the FACE Act also applies to conservative crisis pregnancy centers. And lest we forget, only a few short weeks ago, an IVF clinic was bombed, and it would have applied in that situation too. And so some conservatives are divided on whether or not to get rid of the FACE Act. And so I don't know where it is going forward, but I think these recent instances of violence certainly are not helping the effort. And the Trump administration has already said they are not really going to enforce FACE against people who protest outside of abortion clinics. And so that takes some of the heat off of the conservatives who want to get rid of it. Of course, they say, it shouldn't be left for a future administration to enforce, as the Biden administration did.
It also applies to churches, which I think if you are, deeply religious, that could also be a point of contention for you. But yeah, I think just also with so much else going on and the fact that they've kind of slowed down on taking some of these things up for the whole chamber to vote on outside of in January, I don't really see it coming up in the immediate future for a vote.
Well, at the same time, there are efforts in the other direction, although the progress on that front seems to be happening in other countries. The British Parliament this week voted to decriminalize basically all abortions in England and Wales, changing an 1861 law. And here on this side of the Atlantic, 4 states are petitioning the FDA to lift the remaining restrictions on the abortion pill mifepristone, even as, Alice, as you mentioned, abortion foes argue for its approval to be revoked. You said that the abortion rights groups are shying away from these ballot measures, even if they could do it. What is going to be their focus?
Yeah, and I wouldn't say they're shying away from it. I've just heard a more divided view as a tactic and whether it's worth it or not. But I do think that these court battles are really going to be where a lot is decided. I mean, that's how we got to where we are now in the first place. And so the effort to get rid of the remaining restrictions on the abortion pill, the sort of back and forth tug here, that's also been going on for years and years. And so I think we're going to see that continue as well. And I think there's also going to be parallel to that a sort of PR war. And, I think we saw that recently with anti-abortion groups putting out their own not peer-reviewed research to sort of bolster their argument that abortion pills are dangerous. And so I think you're going to see more things like that attempting to, as one effort goes on in court, another effort in parallel in the court of public opinion to make people view abortion pills as something to fear and to want to restrict.
All right. Well, finally this week, a couple of stories that just kind of jumped out at me. First, the AP is reporting that Medicaid officials, over the objections of some at the agency, have turned over to the Department of Homeland Security personal data on millions of Medicaid beneficiaries, including those in states that allow non-citizens to enroll, even if they're not eligible for federal matching funds, those states that use their own money to provide insurance to these people. That, of course, raises the prospect of DHS using that information to track down and deport said individuals. But on a broader level, one of the reasons Medicaid has been expanded for emergencies and in some cases for non-citizens is because those people live here and they get sick. And not only should they be able to get medical care because, humanity, but also because they may get communicable diseases that they can spread to their citizen neighbors and coworkers. Is this sort of the classic case of cutting off your nose to spite your face?
I mean, I think we saw very clearly during COVID and during Mpox and measles, and yes, what impacts one part of the population impacts the whole population. And we're already seeing that these immigration crackdowns are deterring people, even people who are legally eligible for benefits and services, staying away from that. We saw that during Trump's first term with the public charge rule that led to people disenrolling in health programs and avoiding services. And that effect continued. There's research out of UCLA showing that effect continued even after the Biden administration got rid of the policy. And so fear and the chilling effect can really linger and have an impact and deter people who are citizens, are legal immigrants from using that as well. It's a widespread impact.
Well, and of course, now we see the Trump administration revoking the status of people who came here legally and basically declaring them illegal after the fact. Some of this chilling effect is reasonable for people to assume. Like the research being cut off, even if these things are ultimately reversed, there's a lot of, depends whether you consider it damage or not, but a lot of the stuff is going to be hard. You're not going to be able to just sort of pick up from where you were.
And one concern I've been hearing particularly is around management of bird flu, since a lot of legal and undocumented workers work in agriculture and have a higher likelihood of being exposed. And so if they're deterred from seeking testing, seeking treatment, that could really be dangerous for the whole population.
Yeah. That's it. It is all about health. It is always all about health. All right. Well, the last story this week is from The Guardian, and it's called VA Hospitals Remove Politics and Marital Status from Guidelines Protecting Patients from Discrimination. And it's yet another example of how purging DEI language can, at least theoretically, get you in trouble. It's not clear if VA personnel can now actually discriminate against people because of their political party or because they're married or not married. The administration says other safeguards are still in place, but it is another example of how sweeping changes can shake people's confidence in government programs. I imagine the idea here is to make people worried about discrimination and therefore less likely to seek care, right?
It's also just so unusual. Like, I have not heard of anything like this before in anything that we've been reported where your political party is pulled into this. It just seems so out of the realm of what a provider would need to know about you to give you care. And then I could see, the chilling effect in the same way, where if someone, might want to be active on some issue or share their views, they might be more reluctant to do so because they know they have to get care. And if that could affect their ability to do so, if they would have to travel farther to a different VA hospital, like even if they aren't actually, denying people because of this, that chilling effect is going to be something to watch.
And these are not sort of theoretical things. There was a case some years ago about a doctor, I think he was in Kentucky, who wouldn't prescribe birth control to women who weren't married. So there was reason for having these protections in there, even though they're not part of federal anti-discrimination law, which is what the Trump administration said. Why are these things in there? They're not required, so we're going to take them out. That's basically what this fight is over. But it's sort of I'm sure there are other places where this is happening. We just haven't seen it yet. All right, well, that is this week's news. Now it's time for our extra credit segment. That's where we each recognize a story we read this week we think you should read too. Don't worry if you miss it. We will put the links in our show notes on your phone or other mobile device. Victoria, why don't you go first this week?
Sure thing. My extra credit, it's from the New York Times. The title is, "They Asked an AI Chatbot Questions. The Answers Sent Them Spiraling," by Kashmir Hill, who covers technology at the Times. I had seen screenshots of this article being shared on X a bunch last week, and I was like, I need to read this. Basically, it shows that different people who, they may be going through something, they may have a lot of stress, or they may already have a mental health condition, and they start messaging ChatGPT different things. Then ChatGPT can kind of feed into their own delusions and their own misaligned thinking. That's because that's kind of how ChatGPT is built. It's built to be they call it in the story a psychophont. Is that how you say it? So it kind of is supposed to react positively to what you're saying and kind of reinforce what you're saying. And so if yours feeding it delusions, it will feed delusions back. And so it's really scary. Because real life people were impacted by this. There was one individual who thought he was talking to he had found an entity inside of ChatGPT named Juliet, and then he thought that OpenAI killed her. And so then he ended up basically being killed by police that came to his house. It was just, there's a lot of real life effects from talking to ChatGPT and having your own delusions reinforced. So it's just an effect of ChatGPT on real life people that I don't know if we've seen illustrated in a news story yet. And so it was very illuminating.
Yeah, not scary much. Sandhya.
My extra credit was ambulance companies collect millions by seizing wages, state tax refunds. It's by Michelle Crouch for the Charlotte Ledger. It's a story about how, some different ambulance patients from North Carolina are finding out that their income gets tapped for debt collection by the state's EMS agencies, which are government entities mostly. So the state can take through the EMS up to 10% of your monthly paycheck, or pull from your bank account higher than that, or pull from your tax refunds or lottery winnings. And, it's taking some people a little bit by surprise after they've tried to pay off this care and having to face this. But something that the agencies are also saying is necessary to prevent insurers from underpaying them.
Oh, sigh.
Yeah.
The endless stream of really good stories on this subject. Alice.
So I chose this piece in Wired by Emily Mullen called What Tear Gas and Rubber Bullets Do to the Human Body. Thinking a lot about my hometown of Los Angeles, which is under heavy ICE enforcement and National Guard and Marines and who knows who else. So this article is talking about the health impacts of so-called less lethal police tactics like rubber bullets, like tear gas. And it is about how not only are they sometimes actually lethal, they can kill people and have, but also they have a lot of lingering impacts, especially tear gas. It can exacerbate respiratory problems and even cause brain damage. And so it's being used very widely and in some people's view indiscriminately right now. And there should be, more attention on this as it can impact completely innocent bystanders and press and who knows who else.
Yeah, there's a long distance between non-lethal and harmless, which I think this story illustrates very well. My extra credit this week is also from the New York Times. It's called The Bureaucrat and the Billionaire Inside DOGE's Chaotic Takeover of Social Security by Alexandra Berzon, Nicholas Nehamas, and Tara Siegel-Bernard. It's about how the White House basically forced Social Security officials to peddle a false narrative that said 40% of calls to the agency's customer service lines were from scammers. They were not. How DOGE misinterpreted Social Security data and gave a 21-year-old intern access to basically everyone's personal Social Security information, and how the administration shut down some Social Security offices to punish lawmakers who criticized the president. This is stuff we pretty much knew was happening at the time, and not just at Social Security, but the New York Times now has the receipts. It's definitely worth reading. Okay, that is this week's show. Thanks, as always, to our editor, Emery Hudeman, and our producer-engineer, Francis Ying. Also, as always, if you enjoy the podcast, you can subscribe wherever you get your podcast. We'd appreciate it if you left us a review. That helps other people find us, too. You can email us your comments or questions. We're at whatthehealth, all one word, at kff.org, or you can find me still on X at jrovner or on Blue Sky at Julie Rovner. Where are you guys hanging these days? Sandhya.
At Sandhya Writes on X, and the same on Blue Sky.
Alice.
At Alice Miranda on Blue Sky and at Alice Ollstein on X.
Victoria.
I'm at Victoria Regis K on X.
We will be back in your feed next week. Until then, be healthy.